Families have been torn apart, communities are in tatters. There have been almost 5,000 deaths from Ebola in the 3 worst affected countries, Sierra Leone, Liberia and Guinea.
Ebola is a highly contagious virus and highly lethal. Patients die usually within 7 to 9 days after infection if they're not adequately treated. There are about 20 new cases diagnosed per day. Somebody likened it to a rebel war without guns or bullets.
In West Africa, officials are struggling to contain outbreaks that have turned into major epidemics.
Obviously, people are really worried as to when will this come to an end, and it's quite uncertain right now.
These people, the people of Sierra Leone, need the world to stand with them, to show them support.
Is the rest of the world getting involved in this huge crisis there?
In my research on the disease, often you'd read the news reports which would say this disease had been discovered 40 years ago and there still wasn't a cure. I kind of got a little tired with that, so I actually petitioned the FDA to fast-track experimental therapy, and I came across convalescent serum. Those efforts led to the formation of Sierra Leone Action.
Sierra Leone Action was formed at the outbreak of this Ebola epidemic.
We united on a common mission to improve the outcomes of Ebola virus disease.
Dr. Tijan C is leading the medical effort.
Started doing some research on what was done in the past, and found that in Congo in 1995, when they had an outbreak, some of the doctors actually used convalescent serum.
We kind of focused on convalescent serum as an effective therapy that could work. Convalescent serum is obtained after the survivor's blood passed through the apheresis machine. The red cells return back to the patient, and then the serum, which contains the antibodies, which is what fights the disease, remains in the serum.
It will boost the immune system, and it significantly increases their chance of survival.
One of the most daunting tasks we faced was how to raise funds to purchase the machines. A gentleman named Vital Smith volunteered to put us in touch with Fresenius Kabi to see if they could help us with apheresis machines.
I guess internally they decided to do a good deed.
Our organization is putting together a shipment of 9 autophoresis C plasma devices.
Plasma treatment is nothing new. It is believed that this route of treatment will actually help, as there's a lot of supportive evidence around it.
The reason why we are so gung-ho on convalescent serum is that we can generate a huge amount of doses. The equipment could potentially treat up to 18,000 patients. We are talking with the Sierra Leone government to make sure that convalescent plasma will be part of public health policy as well. That shouldn't take too long, and then hopefully distribution of plasma will be widespread. We're absolutely incredibly grateful for that donation, plus supplies for 6 months and also over 40 hours of training.
This is called the blood clamp, so the blood is going to come up through this blood clamp.
It's been a fantastic collaboration. It really reinforces that we belong to a global village where we sincerely care about each other. If CST is proven to be effective, we have the quantities to make a difference. We're going to say that we're partners in making history here.